Have you ever ignored a small lower abdominal pain, thinking it's just your period, only to find out later that something much bigger was silently damaging your body? What if I told you that one untreated infection could quietly affect your fertility, your future, your peace of mind? Today, we're talking about something many women don't even know they have until it's already caused damage. This is pelvic inflammatory disease, and you need to hear this. Let me tell you about Amara. Anita was 24, busy, focused, and honestly, not someone who runs to the hospital for small things. She noticed a dull pain in her lower belly, some unusual discharge, occasional discomfort during sex, but life was moving fast, so she ignored it. Months later, she tried to get pregnant, and that's when everything changed. Pelvic inflammatory disease, or PID, is an infection of the female reproductive organs, your uterus, fallopian tubes, and ovaries. It usually happens when bacteria move up from the vagina into these organs. The most common culprits? Untreated sexually transmitted infections like chlamydia and gonorrhea. But here's the scary part. You can have PID without obvious symptoms. When symptoms do show up, they may look like lower abdominal or pelvic pain, unusual vaginal discharge with smell or color change, pain during sex, pain when urinating, irregular bleeding, fever in severe cases. And because these symptoms can feel normal or not serious, many women ignore them, just like Anita did. PID doesn't just go away. If untreated, it can cause permanent damage to your fallopian tubes, lead to infertility, increase risk of ectopic pregnancy, a life-threatening condition, cause chronic pelvic pain that doesn't just disappear. So yes, that small pain can become a big life-changing problem. Let's be real and honest. PID often starts from untreated STIs, multiple sexual partners without protection, poor follow-up after infections, douching, which disrupts your natural balance. This is not about shame. This is about awareness. Your body is not punishing you. It's responding to what it has been exposed to. If you go to the hospital early, here's what happens. You'll be examined, sometimes pelvic exam. Tests may be done, swabs, urine, blood tests. You'll be given antibiotics, sometimes a combination. Your partner may also need treatment. You'll be advised to avoid sex until treatment is complete. Early treatment can prevent long-term damage, but delay, that's where complications begin. Here's how to protect yourself. Get tested regularly if sexually active. Don't ignore unusual symptoms. Use protection, condoms. Complete your medications fully. Avoid douching. Go for routine reproductive health checkups. And most importantly, listen to your body. Anita eventually got treatment, but she wished she had gone earlier. Your story doesn't have to follow that path. You have the power to act early, to ask questions, to seek care, because your health is not something to gamble with. If this taught you something new or reminded you to take your health seriously, like this video, share it with another woman and subscribe for real, honest women's health conversations, because here we don't ignore our bodies, we understand them.